Right. Well, good evening, everyone in New Zealand. And thank you so much for joining us for another Dental Chat by Alluro. We're trying to do this more often and, offer content for you. This is our first of the year and we're nearly May. So it's been embarrassing, but it's been a busy beginning of the year after the lockdown that we had last year. So today we're very, very, very happy to have a friend from across the ditch and in Sydney. And as you guys know, Alluro is committed to be a sustainable company, and we would like to be, one of the most sustainable dental companies in the world. And we always look ways to, help practices to become more sustainable and eco-friendly. And not necessarily we're going to talk about buying an eco-friendly, cup. It makes you sustainable. So tonight, Kylie Robb from the ADA New South Wales, which is the Australian Dental Association New South Wales, she's going to join us and talk about the exploring sustainability ways in the dental practices. And she's been doing this for a few years now. So she's been exploring, as the name of the webinar is, a few things. So very, very looking forward to it. And now I'm gonna pass it on to Kylie for the whole introduction.
That's just how I'm just doing my acknowledgement to country, everyone. And we do acknowledge the traditional owners and their custodianship of the lands on which we meet, and pay our respects to their ancestors, and recognise their valuable contribution to Australian and global society. Okay, here I am. Can you all see me with my amazing virtual set? I'd like to thank our producer here for creating this amazing virtual set for us. I'm actually in this tiny little podcast room live in St Leonard's in Sydney. And this virtual set that we've created really is amazing. So I was very excited to be able to share it with you and your viewers tonight. My name is Kylie Robb. I am the Australian Dental Association New South Wales branch head of practice services. My big focus for the last couple of years has been infection control, actually. But what's interesting about infection control is that in dental practices, that's usually a very big space where dental practices can be more sustainable, particularly with healthcare consumers and also dentists and their teams. There's really a big focus in how we can be more sustainable, particularly with the use of plastic, single-use disposable items. And that's not entirely what I'm going to talk about tonight. It's more about how sustainability is actually quite a complex beast. And my approach tonight is not to simply talk about how you can do these things and you'll be sustainable, but more about, well, why is it so complex in healthcare in the first instance? Let's get started. I think the first thing I would like to do is to ask you where you are tuning in from tonight. So we use an interactive platform where you can speak to me. I am live here in Sydney. And if you use your mobile phone, you can scan this QR code, or if you're on a laptop or a computer, you can put go to slido.com and put in the code 468194, and you will be able to interact with us live here from Sydney. So just to get started, and so you can all figure out how it works and how easy it is, I would like to ask, where are you tuning in from tonight? So where have we got? I know all my New South Wales and Australia places, but Auckland, Blenheim, that's nice. Good to see you. Who else do we have? Nelson, Rosedale. Wow, they've got a nice group of people from all around the place. The North Shore. Actually, my grandparents live in Auckland, and it's good to know. I was very proud to be able to present to New Zealand tonight, so thank you very much. West Auckland, Christchurch. Excellent. That's great. So you can see how easy it is to use Slido, and this really helps us sometimes with these sorts of forums. It's not about what I have to say. It's about, what you think as well. And that's what's so great about these online platforms. So let's talk about going green. So this is something that I was requested to speak about at our recent Australian Dental Expo that we had in Sydney last month. And what I find interesting about going green is, well, what does that really mean? And I think at a time where society is really questioning how sustainable it is for us to be in this world of me and right now and what I want at all costs, those days are behind us. So I think for us, it's about understanding that sustainability has become this catch-all term, which includes obviously environmental aspects of the impacts of what we do, but also factory conditions and paying staff. And I was reading about this terrible incident that happened in Bangladesh, the Rana Plaza, where it collapsed with 1,000 people working inside of it, making all these cheap disposable clothing, not getting paid very well. And it's like, is that sustainable? And do people know where their products are really coming from and what they're inadvertently contributing to? I think professional communications and good intentions are not enough. We need to convert that aspiration into action, and that isn't always as easy as it sounds. So let's have a look now at what the difference is between going green versus going sustainable. And if we think about going green, it's really using products and services that reduce an environmental impact compared to something else. So a good example is instead of using a plastic cup, you're using a paper one, but you're still using a cup. And I think for me, and I guess a bit about my own background, I have a Master of Health Service Management and Clinical Leadership. I'm a credentialed infection control professional. I'm a board director for the Australasian College for Infection Control. And I guess part of my approach to dealing with problems like this is the management and leadership angle of, well, how do we actually move to that next step, but being a bit more strategic as well when we think about these concepts. Because a sustainable product is a service or products and services that refer to the long-term multifaceted implications and impacts of their use. So we're talking about, how sustainable is it for us to just waste all this water if we're living in the desert, simple analogies like that. So I think for me, it's about reflecting or observing the status quo and working out, well, is this what we should be doing anyway, rather than just replacing something with something else. Now, greenwashing is a term that has been bandied about I think it's a term that actually was coined in the mid-1980s by an environmentalist by the name of J. Westerveld. And he created this, or he wrote this essay talking about hotels telling you that you should, save the world by not getting your towel washed every day. And that's where the term greenwashing actually was first, bandied about. And what he was saying is that this isn't to save the environment. This is for you to reduce costs on laundry, and calling it out for what it is. And there's been some pretty big notable instances in the past where the greenwashing is being called out. For one I was looking at today was Coca-Cola. They've recently been a lawsuit's been filed against them for saying that they're this sustainable eco, company, but they're the biggest polluter when it comes to all their plastic bottles that they create. And, this is literally from their website, is this Coke bottle with some plant growing inside of it, as if it's this, wonderful company and feel better, even though the pollution is out of control. So greenwash marketing. So what that's really saying is that you're making claims that you're environmentally conscious for marketing purposes, but you're not actually doing anything for sustainability. And what the literature is saying is that this is the link that we see that is an unintentional consequence, in that people do have good intentions and they really do want to be sustainable, but they just fail to actually execute when it comes to those actions to do do what they're saying. So some ways to avoid the greenwashing trap is to avoid fluffy language like natural and eco-friendly. Like, really, what does that even mean? We see that a lot. Eco-friendly this and that, but how is it? And I'm very much data driven, and it's like, show me the facts. Green products versus a dirty company. So what we're talking about there is, watch out for like hypocrites. So we've got, all these natural, eco-friendly LED light bulbs, but they're sort of put together in some factory that isn't really taking care of, and all this, chemicals are going into the little rainforest down the street. So there's, this happens. Evocative pictures providing unjust green impression. Thanks, Coke. I literally got that from their website today. And designations that are not credible. It's like saying that, green cigarettes. Do you know what I mean? Those sorts of things are not great. And, imaginary friends. So what I mean there by that is putting logos or kind of, and I actually say that, this is a great idea, is to align yourself to companies that are doing well in their sustainability efforts, but those companies don't exist. So sometimes we'll see, this little rubber stamp of eco accreditation, but there's no such thing as that eco accreditation. And just blatant lies. Now, obviously people with good intentions and doing what they think is right, it's the minority who are going to be going out of their way to lie to their consumer. But there is nothing like destroying business trust by a consumer finding out that they've been lied to by a company that they thought was doing better. So I guess what I'm trying to say here is watch it. Be careful. So some things that you can do, and I'll just, run through these ones, a couple of these ones, is that, it is easy for the green marketing to translate to greenwashing in practice if the organisation doesn't live up to the standards or those sustainable business practices. So I guess the approach is that some ways that you can make sure that you are doing the right thing is to look at, well, are things that you're doing, are they manufactured in a sustainable fashion? And how would you know? Are they free of toxic materials or ozone depleting substances? Are they made from renewable materials? And, is there excess packaging? Are you buying products for the long term rather than this disposable nature? People who get beautiful, nice cars plan to have them for a long time. They're not just, cars aren't a great example, but it's more of that buying for quality rather than cheap, discarding them for later. So let's have a little think about now what some green products are. So with the definition of a green product, it's replacing something with something else. So instead of a plastic bag at the shops, you get a, one of those, what are they? The little long-term bags. Simon's nodding. Yeah, reusable. Thank you. 100%. So bamboo anything. Now, what's interesting about bamboo is that, yes, it's a renewable product, but it takes a lot of water to grow bamboo. So a paper straw is a really good example. So it's a replacement from the plastic straw to a paper one. Metal straws, paper-made stuff, so a carton. Yeah, look, I agree. I think that is a green product. I bought some makeup online yesterday, and it was like, do you want our sustainable packaging or our nice shiny packaging? And I'm like, oh, so hard to decide. But it's this replacement or instead of. And I can remember watching like American movies back in the day, and it was like paper or plastic when you're at the shop. So it's giving you that alternative to something that is more green. Let's have a look at examples of green services. So we're talking more about, instead of just the, the end result of the product manufacturing process, what are some green services? So if we think about, waste management, that's actually a really good example, because there's some countries in the world that don't have a coordinated waste management program, in that there. No one will come and pick up a rubbish bin. You have to figure out what you do with your own rubbish. And that's where that rubbish ends up in, I don't know, big river systems and things like that. So public transport's a good example. So instead of, driving your own car, you're catching a bus or a train, which is more environmentally sustainable than every single person who's on that bus driving their own car. Compost is a good one too. So composting, I know the North Sydney Council here, they have, green services where they'll provide, apartment buildings opportunities to get rid of their green waste rather than just putting it in the rubbish bin. So there's all these different services that are available to help us to be more green. So it's not like a product, it's a service. Now, this slide here, oh my goodness, I cannot tell you how long it took to pull this together because sustainability is a very complex space, and it's because, achieving this sustainable delivery model of healthcare is quite challenging. And I guess the factors that relate to sustainability include, particularly in Australia, the complex structure of Australia's health system. And that's really reflected in its funding arrangement, okay? So in Australia, the health system is funded by all levels of government, including federal and state. And we've also got private health insurance providers, injury compensation insurers, and the, Joe Public as well. So the cost of providing this equitable, safe and quality healthcare provision in Australia is increasing. It's very expensive to provide healthcare to healthcare consumers, and financial constraints for healthcare to be sustainable does need to be in place. So, at what cost to those who need to access healthcare? What is that going to cost? Are we going to be giving everyone bionic elbows for elbow replacements? And is that every single person, even though that elbow is going to cost the taxpayer, $500,000 per surgery? How sustainable is it to be able to do that? And healthcare expenditure has been steadily rising in recent decades. So according to the Australian Institute of Health and Welfare, Australia spent $185 billion on health goods and services between 2017 and 2018. And that's about $7,500 per person. So increasingly, governments are definitely becoming concerned about how this level of public spending will be sustained. The healthcare sector is a major contributor of carbon pollution. So to give you a little statistic, in Australia alone, the health system's carbon footprint is 7% of our total emissions. So that's the equivalent of the entire emissions for the whole state of South Australia. So every single light bulb that's turned on or waste that goes in the bin, healthcare in Australia on its own generates that whole state's worth of carbon, which is a lot. So it's a big, we can't just say, let's just use less plastic or waste, and the healthcare is such a major contributor in its own right. So, and that's a trap, because the other, it's like a cyclical problem where we've got healthcare are huge generators of carbon, yet which causes climate change and other and which then causes more floods and fires and what are we having at the moment? Japanese encephalitis over here in Australia. But then that sends more people to needing healthcare, which then contributes to all these other problems. So it's a big, what we call a wicked problem. Okay, there's lots of factors here, particularly with healthcare, for why sustainability is a challenge. The societal impacts on the provision of healthcare. So with COVID over here, it was a total battle, and our friends in Victoria, seriously, they have had just 2 years of punishment with COVID, and particularly the residents in the community down there. They've been locked up. It was a bit of a joke here with the most lockdown city in the world, and that causes a lot of mental health concerns, but also for those frontline healthcare workers who are just constantly having to provide care, no rest, workforce shortages. It's not sustainable for people to be so stressed and concerned and anxious when doing their jobs. And governance and leadership intentions to drive sustainability improvements needs to be prioritised. I have reached out to the New South Wales government here. They've got a Sustainability Advantage program, which we're really hoping to be a part of. But that's the John Perrottet government here looking to get New South Wales to net zero. And they're going for the really big players to get them on track, because that's obviously they can really manage those resources to support those big industry to be more environmentally friendly, and then the whole state benefits of that. So I'm looking at getting involved in that. It's such a huge topic, and I'm doing my best to be across it. One of the things I do reflect on myself is, who am I to be standing here talking about this? And I feel like this is something that many of us feel, is that, sustainability used to be a bit of it was the minority of those who were talking about it, like the hippies, the greenies, those people who wanted to be more green 10 years ago, whereas now it is becoming more mainstream. And I'm very concerned about my own personal brand and myself becoming a greenwasher. I'm talking about all these different concepts, but who am I? What am I doing to make a difference? And look, I'll tell you a little story here. Here at ADA New South Wales, we found out that we weren't recycling. We thought that we were all putting our recyclables into the recycling bin, and we then found out that all waste was going into one big bin down in the basement. Now, when that happened, when we found out about it, some people were so upset and cranky that was happening that we almost had people walking out and leaving their jobs because of it. And this, I guess, as far as an opportunity for us, has been a big one. We're definitely looking at ourselves and what we can do better, and I don't think any of us are perfect or striving for perfection when it comes to sustainability. It's about, well, what am I here for, and what can I do, and what can I contribute? And I think that also leads to healthcare. They do have a very strong track record for leading change in complex areas. And I know I've been talking here about how hard it is and all the challenges that healthcare face, but just take a look at the wins we've got on the board here when it comes to, I guess, public health measures that have increased the, people's lives. They had happiness and health, So the Public Health Act in the UK, that actually led to the provision of clean water and good sanitation over in the United Kingdom a long time ago. And that obviously led to the quality of life and life expectancy increasing to the point now where we just expect that when we turn on the tap, it's water that we can drink. And in the dental space, now this is something that we are doing something, okay, and particularly healthcare. So I've just done a quick little roundup of initiatives that I can see just here in Australia, but also overseas. We have the Ramsay is a major player for healthcare here in Australia, and we've got the South East Sydney Local Health District, their environmental sustainability strategy, World Health Organization, Australian Capital Territory, so down in Canberra, the FDI, which is the World Dental Federation in Geneva. They're also doing some work in this space. So it's not to say that the healthcare profession hasn't been doing much in this space. We definitely have, and now it's a great time to talk about it. So in dentistry, because I think that's why we're all here, and let's have a look at how that works. With the World Dental Federation, they talk about sustainability as how that integrates a broader commitment of the oral health profession to social and environmental responsibility. Now, they do have quite a focus on the environment. Now, obviously for sustainability, that is the natural link, excuse the pun, but I'm also talking about the nature of how your products and services are getting to you. How sustainable is it for people in third world countries to be not getting paid and risking their lives to create products and services for us that we just throw in the bin without any hesitation. So it's the wider aspect of sustainability, more on the environmental, social, and the governance side too. I'd like to ask you again, what forces do you think are driving sustainability? Why now? Why does this matter today? Why are you online? Why do you think sustainability is becoming such a priority at the moment? I think about, I guess, some of my reasons, and COVID in particular actually jarred us all to just stop and say, what am I doing with my life? And how sustainable is it for me to be stressed at work, working, in traffic every day and stressed and rushed? I actually stopped and thought about what's important to me. Environmental legislation, so that is definitely a driving factor. So on the 1st of June here in New South Wales, you will not be able to use a plastic bag from a shop. They're getting rid of plastic straws, which have, that's already been phased out, but knives, forks, the whole lot. It's a lot of changes coming as far as legislation for environmental impacts. The price of stuff, yep, health in general, political, definitely. We've got an election coming up and it's a big topic. Consumer pressure, 100%. So consumers are definitely driving a sustainability agenda because the literature is saying, research is saying that they will spend more to align themselves to companies that share the same values and ethics that they have, and they're looking for companies that are going to do more because they personally can't do it themselves. Now, a couple of other forces that I think are shaping sustainability is this rise of the purpose-driven consumer. Just like I was saying before, consumers are looking for companies and services that are doing more for the environment, and that is important. You will notice when you go online to buy clothing or services, sustainability is right up there because they know healthcare consumers, or consumers, I always say healthcare consumers, are looking for that. Brands are reevaluating their purpose and values, and a lot of that is to do with governance. They know as a governance risk that if they are blowing up an old ancient mine, an old ancient Indigenous site in the Pilbara for a bit of coal, people don't like it. Even if they were legally able to do that, people are like, that is not what I want to contribute to. So shareholders are talking with their feet by just not even supporting companies like that. So the risks are real. If you are a big corporate and you're doing the wrong thing, and you should have been aware of that risk and a reputation and brand, that does have consequences. So they're reevaluating, what are we here for and what can we do? And investors are expecting companies to be more resilient as well. And I think that comes from I guess the good things about these sorts of things is that this change is actually inspiring innovation, and that's what I'm really excited about, and we'll talk a little bit more about that in a moment. One other thing that we're seeing here in Australia in particular is this the Great Resignation that's happening around the world, where employees are the pandemic has fundamentally changed the relationship between employers and employees. So in the US and the UK, the quit rate is at historic highs and wage growth is at the highest level in decades. And employees are really looking for more from their employers, including more flexibility and more meaning in their work. And what I mean by meaning is the work that they're doing has purpose. I am like me working here at ADA New South Wales, the work I'm doing, standing here right now talking to you, is contributing to hopefully a better world for all of us. And that motivates me to work hard, study hard, and do my best. And this is what employees are looking for generally when it comes to their work. They want really want to see that building of trust with meaningful purpose and values that they can align to, and taking action on other issues employees care about as well. So I'm talking about, what I love about working here at ADA New South Wales is we have a very diverse workforce, from people who are a bit older to younger, from lots of diverse backgrounds. We have quite a number of us who English is not their first language, and that creates a very rich tapestry of opportunities for us to, I like working in a workplace that actually reflects the community that I live in. And that also leads to opportunities as well. So teams do perform better when there's a clear sense of why they exist, and they're not here to exist to make sure that their principal dentist is earning as much, taking as much, and not caring about them or anyone else. They don't like that. So what are some sustainable opportunities for dentistry? So the ones that I see is obviously reducing single-use plastics and waste. I can't tell you the number of dental practices that I visit that are not recycling, even just plastic drink bottles. And I guess the things I see as well is understanding supply chain impacts. And I know some of our big corporates, and I know Luro as well, you're talking about it, is making an active effort to make sure that the products and services that they're providing to their own consumers, being dentists, have a sustainable, there's a sustainable eye over them as to what that looks like. The other opportunities I see is this innovation and efficiency improvements. Why are we going through 1 million gloves a day? That's expensive, but it's also a waste. How can we do more with less? Employee relations, improve culture, even the sustainability efforts that we're doing here for members at ADA New South Wales has helped me to forge better relationships with people I work with who really care about this. And I'm really enjoying getting emails and texts and things from dentists alike, but also my fellow colleagues saying, oh my God, check this out, you should listen to this podcast. It's all about net zero. And I feel like there's that shared excitement about what we can contribute. And that's an opportunity for dental practices as well. Now, a couple of, I'm talking about a lot of concepts here. There's plenty of things that, a practice could do to be more sustainable. And I was really mindful of not going down this road of going, hi, I'm Kylie, and here's all the things, here's a little checklist of things that you can do to be more sustainable. For me, it's about understanding, well, why do you care about it at all? Because every single practice will have a different approach to what it is they care about. And that's also a reflection of the community that they're in, what it is that they think is important to them. And, for example, we had some terrible floods over here in northern New South Wales, all around Byron Bay and Lismore areas. We had a number of our members who their dental practices were completely flooded, and some of them have hung up their handpiece for good. It's too much for them to try and rebuild from that. But one of the things that a dentist in Sydney noticed was that none of them had any cleaning supplies. They were going to Bunnings, but for, 300-kilometre radius, every Bunnings and Woolies had run out of mops and brooms. So what they did is they actually went and bought about 50 brooms, buckets and mops. And one of the dental assistants, her husband was like a truckie or something, and he's driven up to Lismore and given out all of these to the community. And that made them feel really good. And there's the team morale at that practice in Sydney was like, I'm doing something. And it's not, oh, I'm, recycling. It's I'm helping to contribute to a society that I care about, and knowing that those people who are really struggling, they know that I'm here thinking of them. And that's sustainability as well. So having a clear, sustainable mission statement for your practice will help you as a dentist to have control of what sustainability looks like in your practice. What I mean by that is if you mention a word to anyone that you want to be sustainable, and it's not a framework around how that's going to work, you're going to have dental assistants who will be like, oh, great, well, no one's allowed to celebrate the Melbourne Cup again, okay, because we don't like horses. No. and you're like, oh, is that, and we put it all on social media, and it's like, well, hang on, is that the views of our practice? Is that the views of do I really care about that? And then all of a sudden you might not feel like you've got control over that. So what I'm trying to say here is think about what problems you are here to solve and what that looks like on a day-to-day level in your practice. So things that, and this is where your mission statement comes into that. It forms the foundation of those efforts, and it states what your practice already does and what it's going to do. So a couple of examples of some mission statements are things like, it's like 3 parts, okay? So you've got the why, the goal, and the success criteria, okay? So we will reduce the use of single-use plastics to preserve the environment. Like, I've just made these up, but these here are very specific, targeted statements that tell your practice, your community, what you're here to solve, okay? And this helps you to avoid the greenwashing trap, okay? Because saying, oh, I'm going to be sustainable, full stop. It's like, well, what does that even mean? How are you going to do that? And what does that mean for your team who are wanting to really get behind this initiative? So our goal is to be energy efficient to minimize our carbon footprint, or we're committed to patient safety to reduce suffering. Sorry, that's a bit of a strange one too, but you get the idea. And then the final one is our mission is to be diverse and inclusive to improve our community opportunities. So you can see they are really different, but already, I'm sure, with each of those statements, you could list right now what you would do to act on these. So just with the diverse and inclusive, I'm not sure when the last time you looked at your website with those good old stock photos, does your website images reflect the community that your practice is in? That's a big thing about inclusivity, is making sure that when we're watching TV or reading magazines or online, that we're actually seeing that diversity that our cultures have and how great that is, celebrating that. Now, let's another interaction here. When you think about sustainability, what are the things that upset you the most when it comes to working in dentistry? So we've just talked about all these difficulties that we have in healthcare and why it's so complex for sustainability efforts. What are the things that you go, oh, I hate this about with dentistry? Okay, when it comes to sustainability, like you're a dentist, you're working in a dental practice, what frustrates you when it comes to the type of waste you're generating? And that's a good place to start. So what have we got here? Personal protective equipment. Look, particularly during COVID, oh my God, I can't tell you the number of masks I see floating around the street. It's terrible. Single-use products. Now, they are rife. Now, particularly in hospitals. Oh my goodness, this is shocking. It's cheaper to throw away a disposable flat plastic than it is to just buy a metal one and reprocess it. So they just throw them away. And I'm not all hospitals, but that's real. Okay, it's cheaper to not be sustainable. Okay, so that's again what's important to you. The cost of going green. Yeah, okay, I hear you. And this is where, as an emerging kind of area, any sustainable efforts that you're going to introduce could be more expensive. So let's talk about solar panels, for example. When they first were available to go on roofs before the government gave you all these nice incentives to be able to put them on your roof, they were really expensive. Even electric vehicles at the moment, you are an early adopter if you get one of those, and you will pay for it. So it is more expensive. And this is where having that really clear mission statement will help for you to target what I'm going to focus on and what benefit that's going to have. It feels like it's an impossible mission. And this is, you are speaking my language, my friend, because I've spent 150 hours pulling this presentation together because I just felt so overwhelmed and didn't even know where to start. So it's real, and you're not alone. Okay, now I want to introduce you to a couple of ladies here. Now, these three ladies, this is a bit of a case study. They determined that in their hospital over in London that they were going through way too many gloves. And what they determined was that they were noticing that gloves were being used when there was no body fluid exposure. So they were thinking, oh my God, we're just going through so many gloves. And the problem they identified was, well, the goal they identified rather was how can we reduce unnecessary glove use in this hospital that they worked at, but still maintaining patient safety. Okay, so what they did was they empowered their nurses to think about the key principles of glove use, and that is only wear gloves when there's a body fluid exposure risk, or if you're handling like cleaning chemicals and things like that. Their work that they did. And again, you can't measure success, and you won't know you're successful unless you measure. So they actually worked out how many gloves they were using, and then at the end of their initiative, how many gloves they were using. And they worked out that they reduced 21 tons of waste from focusing on when gloves should be worn, rather than and came with the educating the teams and really driving that change initiative. Okay, so they saved their hospital over $200,000, and what they also found was that the hands of the healthcare workers were healthier, and they actually had a phone call from a patient's dad who said that, look, I'll be honest with you, whenever someone would walk into my son's room, they would put gloves on, and my son would see those gloves as a trigger for pain or something bad's going to happen. And all they were doing was like checking his pulse or doing whatever they were doing. There was no body fluid exposure. So that was another, good outcome from them having a more targeted use of gloves. So I guess this is the perfect quality improvement initiative because it obviously has obvious, environmental benefits. But it's also challenging the status quo with evidence-backed, decisions as far as when gloves should be worn. They've got the data from before and after, and, little kids are happy as well. So this is a great quality improvement initiative, and these girls have actually been talking about it over in the UK at some conferences and things too. Now, for you and crafting your unique sustainability strategy, I guess that some things I would be focusing on is know where you're at. Get feedback from those who matter, okay? And I'm talking about your like staff, friends, family, yourself, thinking about what is it that is important to you, okay? And focus on what is important, most important to you and others. Is it to save the environment? Is it to be more inclusive? Is it to be, net zero or whatever that might be? You can't do everything. And I think some of those challenges that we were talking about earlier is it just feels so overwhelming. There's too much to do. And the trap with that is I'm just not going to start or do anything. So start small, and that will help and get some small wins. Gather data to measure and share success. So that's what these girls did up at that hospital in London. They knew how many gloves they were using so that they were able to then measure that success from 1 month to the next. And look at the process. You can't have all these lofty goals without an actual plan to get it done. It's no use saying to your junior dental assistant, right, let's be more sustainable. Good luck. Like, you need support. It has to be an execution plan. Like, how are you going to do it? And don't get paralyzed by perfection. Just start. Just do something. I will say, though, that any changes that you make, you need, especially when it comes to patient safety, be careful because we need to be sure that there's no unintended consequences, particularly with that change management there, which I can only go through so much today, and I appreciate your patience. Just on the risk-based use of gloves. Now I do run a full-day infection control course online, see there. And I do have a 2-hour one that I'm starting next week as well. But one of the focus on these courses is really drilling down into those key elements for decision making. Okay, so instead of a big list of when you should wear gloves, we talk about a principle that you can apply to lots of different scenarios. So with gloves, You only need to wear them when there is a body fluid exposure risk. Putting a bib on a patient, no body fluid there. Setting up instruments that are semi-critical. Your gloves are non-sterile. They're not cleaner than your hands, okay? So it's really just challenging those mindsets, and this will help you to reduce glove use. Gloves don't replace hand hygiene. See that a lot. I'm just going to put these gloves on and then rummage around this drawer or open this cupboard or take these clean items back to the treatment room. And that's it. You do not need gloves to set up a treatment room, access clean areas, or transfer items from one place to another. Just a couple of, strategies that I see for a practice if we were to, throw some ideas up there, is to start recycling. So how are you going to do this? You could organise a recycling bin. What are you going to put in the recycling bin? They need to be in the kitchen or areas that you're going to be generating that waste, and monitor for quality improvement. I was at a practice recently and we were noticing that they had these giant contaminated waste bins and everything was going into them. Now that all gets incinerated. So that's a pretty big environmental burden for no reason, okay? So we need to be checking that these changes that we're implementing are taking place. And it is important to identify why are you doing this? Why is this important? Because this is likely to get your team on board to want to get on board with these initiatives that you're creating. To use less steri pouches. Now, you can individually wrap every single item, but most flat plastics, for example, or mouth mirrors do not need to be sterile at the point of use. They need to be sterilized, but if you're storing them appropriately, they don't need to be stored individually in packs. So I see lots of opportunities for using cassettes compared to individually wrapping everything in a plastic bag. Looking at instrument kits and clustering instruments that are commonly used together to reduce more bags. So there's a couple of strategies there that you can implement to reduce waste while still achieving the outcome of good patient safety outcomes. And I guess another good, low-hanging fruit, if you like, is to be an employer of choice. And looking at your website for how you can share your shared values and purpose, and looking at your stock images that you're using, and include content about how you're such a great workplace. Like if I was a patient of yours and I'm looking at your website and you're talking about how you care about your own team, that is a company I would want to align with, because I want to know that my friend's daughter who you employ is happy when they come home from work each day and they're not bullied or treated poorly and getting paid fairly. And just on the infection control side of things, this is probably more of my specialty, particularly when it comes to reducing waste and single-use items in this area. Sometimes I find the challenges with taking action in this area is lack of confidence in that if you were to make a change or do something, it's like, well, what if I get in trouble, or what if that's not right? So there are lots of opportunities. And it really comes down to having good, strong foundational knowledge of the concepts of infection control and what risk you're really trying to manage with that single-use item, for example. So some things I see straight off the top of my head when it comes to infection control is saving water. If you're washing your hands between every single patient, particularly if you're an orthodontist, that's a lot of water that you're wasting, and you could use alcohol-based hand rub for that. Reducing use of chemicals. Use of water is a big deal, but also reducing PPE use. You can be very strategic with its use, particularly with COVID. I'm not an expert on the New Zealand laws or rules, but here in New South Wales, it's really more about respiratory protection at the moment, rather than wearing a gown for every single patient, whether you're expecting body fluid exposure or not. Optimizing risk-based principles to reduce barriers. So I'm talking here about if you're putting a barrier over your entire X-ray, head, well, why? it's a non-critical item. That X-ray unit has the same category of risk as the actual dental chair itself. You're not putting a giant plastic bag over that. So thinking a bit more strategically about the nature of the products that you're using and what risk you're trying to manage. And can you recycle more? I mean, there is really so much opportunity in this space, which is pretty exciting to me. Do speak to your suppliers. They want to help you, and I'm sure they've got plenty of great ideas to help you to be more sustainable. And in conclusion, and I thank you all for persevering with me for this presentation. I'm very mindful that it's just me talking for so long. But in conclusion, sustainability is not just about environmentalism. It's about looking after your community and those that are working for you, your patients. And what kind of world do we want to live in? Are we happy and feeling like we're contributing to something bigger than ourselves? Innovate to improve rather than simply just replacing with something that's green, okay? Look at how many gloves you're using and, use them a bit more strategically. And obviously there is no glove alternative that's more green, and that's probably the point there as well. Get your team involved. You can't do this on your own, and I think you'll find that your team have got lots of great ideas. But as a dentist, I want you to harness that and have a framework for how you implement sustainable practices into your business, because you need to control it. Figure out and prioritize what you care about, because that's the risk. If you're doing all these activities that you don't care about, well, they either don't happen, but it's on your website that it is, and you run down the greenwashing trap. Stop wasting gloves, and infection control is a really good place to start when it comes to reducing waste. I do have a new course. It's starting next week. It's a new short online course, and you can visit our website, adanewsouthwales.com.au /CPD, and we'll be able to hook you up to come along with this amazing virtual set that we have. But that brings me to the end of my presentation. Thank you all for hanging online. It was my pleasure to be able to present to you, and over to you, Rudy.
Hello, everyone. Hey, Kylie, what a presentation. Wow, that's pretty cool. Thank you so much, Canasta. Thank you. I've made a lot of notes there so we can suggest stuff, and I totally agree with you on the fact that it's just about what you can do, and don't compromise, things that they're important to it. But exactly, you don't put a giant plastic bag across the dental chair, right? And so, yeah, I totally agree with you. It's a few things that are over the top, and it's just about to do our own, analyze what we're doing and what is possible and what is not possible. We obviously not only try to be part of agency that they are, doing good for the environment. And this is just a random example, like our dental chairs, they do beehives. So they kind of help to invest part of their budget, they invest into beehives, and that's kind of random, but it's their way to do it. We have we used
carbon
to have
offsetting.
Yeah, correct. Yeah, and then we used to have instruments, and these guys, they used to do like 100% zero carbon. Like all the energy that we're using on the producing, they were using to heating, they were using to solar to produce, to use all the computers and stuff. And the design of the building was eco-friendly, so it was cool during winter and warm during summer. It was really smart, like super smart. So it's just about to find that. But yeah, I mean, we do what we can, and we're always looking for ways to help. And I agree, the gloves is just big. When I saw the gloves, like the gloves, but well, it is something that I have to wear. Well, you probably have to wear gloves. You have to wear a mask, right? So what's you can do? We used to have a biodegradable mask. Actually, they stopped making them when COVID hits. They probably stopped making those and start doing just the day-to-day mask, right? But anyway, hey, look, it seems that we don't have any questions, but if anybody has any questions, you can either ask now on the chat, or you can email out to us or to Kylie direct. And I'm really looking to see your next course that you have set up. And maybe next conference in Australia, or maybe we'll see you here speaking for us.
Yes, you never know
conference.
your luck in the big city.
Yes, exactly. Come and see your grandparents, and then come and do a later thing. But thanks everybody for joining us. Our next in the chat is Teresa from San Francisco. She's one of the editors for Dr. Bicuspid, and she's gonna come and talk to us about the trends that they're going, from ethnicity and females and males, in dentistry, and also what's happening in the US at the moment in terms of new technologies and what's people doing. So yeah, we've set it up a date, not confirmed yet, but it's going to be in June, beginning of June. So give a pause, and once you join once in DentaChat, you're always on the mail to it. And also all our DentaChats are posted on our website. We have a little category there. But nothing to say. Good evening, everybody in New Zealand, and also for you guys now. I think it's nearly 5 o'clock for you guys. And thank you so much, Simon, for helping us. It was great presentation. This is the fanciest presentation we ever had. It's amazing. And Kylie, thank you so much. We really appreciate it.
It was my pleasure. It is our pleasure, and thank you, Rudy, for asking us. It is a privilege for us, and we appreciate it.
Okay, guys. See ya. Until next time.